I'm first going to perform hand hygiene. Then, I'm going to introduce myself. Hi, I'm Megan. I'm going to be your student nurse today. Can you tell me your name and date of birth?
My name is William Jenkins, and my date of birth is September 23rd, 1999.
Okay, I'm going to check it. Okay, you're right. We're going to do a respiratory assessment today. Is that okay with you? All right. First, I'm going to inspect the breathing. So if you could just sit upright. I'm just going to look at you. All right. Breathing appears unlabored. The depth is normal. And now I'm just going to count the rate. So... Alright, the rate is 12. Pattern appears normal. Now I'm going to inspect his skin color. No sign of cyanosis. He appears to be tan and normal. I don't see any abnormalities in terms of skin color. And his facial expression is relaxed. Now I'm going to check his level of consciousness. So can you tell me your name?
William.
And where we are?
The hospital. Or my room.
Okay. And what are we doing today?
You're giving me a checkup on my lungs and breathing.
Okay. And do you know the date or the year?
2020.
All right. So he is alert and oriented times 4. And now I'm going to inspect your anterior posterior transverse diameter. So first I'm going to inspect the anterior posterior. Okay. Now transverse. Alright, the ratio is 1 to 2. So now I'm going to palpate. So I'm going to check for any lumps, bumps, masses, or tenderness over the thoracic cavity. So I'm going to... was there any lumps, bumps, masses, or tenderness that you noticed?
No.
All right. Now I'm going to have you turn to the side over here. Okay. And all right, I'm going to check your thoracic extension. So I'm just going to put both my hands on your lower back. And when I tell you to, just go ahead and take a good deep breath in. All right, you can do it. All right. Okay, so thoracic extension is even and both hands went in and out symmetrically. And now you can turn back around with me. All right. And I'm just going to do percussion on your thoracic cavity. So I'm going to use this, and I'm going to use this side. I'm just going to come behind you here. I'm just going to... All right. Thoracic cavity appears to be resonant throughout. And now I'm going to listen to your lung sounds. So I'm going to auscultate. And I'm going to listen with the diaphragm. So every time I move my stethoscope, I just want you to breathe in and out. And I'm going to do 6 on your anterior, your front, and 6 on your posterior, your back, and then 2 lateral. So I'm going to start over here. All right, sounds good. Now I'm going to do your two lateral. Can you just lift your arms for me real quick? All right. I'm going to do your six focus. All right. So, lung sounds are clear to auscultation throughout all of the lung fields. So that's going to conclude our respiratory assessment. Now I'm going to move on to the cardiac and peripheral vascular assessment. I would start over.